Howdy there. This is Dr. John back with you again, and I'm excited to be here. Got quite a few things that I'm interested in talking with you about. Some of the time, most of the time up until this point, I have gone a little bit deeper into a few topics, spent 45 minutes to an hour, and I will continue to do that going forward. But I'll intersperse that with a few sessions where I come in and talk about a bunch of things that are on my mind or research that I've seen recently. And I won't go into as much depth and I won't do a PowerPoint. I'll just kind of talk about it. So this is one of those days. The good news about that is there's pretty much got to be something you're going to be interested in because I'm going to hit so many different things. The bad news is I'm not going to go into as much depth. Now, before I go ahead and get started, Catherine is going to come on and give you her health tip for this week.
Hello and happy summer solstice to everyone. The longest day of the year. Exciting. So to celebrate summer, I wanted to talk about the herb Chrysanthemum. It's a great summer herb to be able to enjoy in many different ways, especially in the summer. And I'm going to talk about the benefits of Chrysanthemum. One of them is the biggest one is that it's a cooling herb, and that's why it's great for the summer. And so it helps to cool down the body, especially if you've been in the sun too much, if you're dealing with a sunburn, if you're feeling like you're having some heat stroke, get some chrysanthemum in you. That'll kind of help to cool things down. Other things that it will do is it helps to relieve congestion. It does this by strengthening the lungs. So anyone who tends to be more prone to lung problems, this is a great herb of helping with the lungs. Has some antihistamine properties, so great for allergies as well. This herb is it helps specifically with the heart, which is also, the heart is the main meridian in the summer. It's the one that's abundant and big. And so with the heart, chrysanthemum helps to improve blood flow. It reduces blood pressure, and it also helps to treat blocked arteries and veins. One other thing that chrysanthemum does is it helps to improve liver function. It also boosts immune function, and so it has antiviral and antibacterial properties. So just great all in all. But one of the biggest benefits of chrysanthemum, one that's best known in Chinese medicine, is the potential of helping the eyes. Chrysanthemum can help to improve eyesight in general. It also helps to reduce eye strain. Helps calm red eyes. It's great for when you've been on the computer for a long time. You can drink this when your vision becomes blurry or your eyes are tired and dry. You can also just soak either a towel in chrysanthemum tea or some cotton balls or something and put them topically on top of your eyes to help to clean and relax them. Many different uses for this. You can also use chrysanthemum tea to help to calm down sunburns. If you have been out in the sun too much and you're red, this helps to calm the skin. So many great things for chrysanthemum. Good to have in your medicine cabinet and just to sip on throughout the summer.
Thank you, Catherine. Yeah, when I was in school, I remember during the winter, all of the doctors, so they had these double wall glass cups so you could see what was in it. And they would put herbs in and then just pour hot water over it all day. And during the winter, they would have the herb Danshen, D-A-N-S-H-E-N, or salvia, which is kind of a magic blood clot destroyer and blood flow stimulator. And they would walk around all day sipping Danshen. And in the winter, that was in the winter. And in the summer, they would walk around with chrysanthemum. And there's white and yellow and chrysanthemum. They have slightly different uses, but it is the first go-to for any form of eye problem as a topical. So it's fabulous. So let's go ahead. I'm going to talk about a few things. And here we go. So I want to talk a little bit about a study that came out recently, last week actually, looking at pre-cancerous signs on the skin and things to watch for. So I just want to mention briefly, there are many types of skin cancers. almost always they fall into one of three types: melanoma, basal cell carcinoma, and squamous cell carcinoma. And there are others. I think I caught one 2 years ago that was the lymphoma caused skin problem, but they're pretty rare. And so the one that we tend to think about the most, that's really gotten the most press, is melanoma. And at one time, that was pretty much seen as a death sentence. In fact, I have a patient from 25 years ago who I saw every week for almost 15 years. And I said to her, you probably don't need to see me anymore. She said, everybody else in my melanoma group is dead, and I'm going to come forever. And so it had become really a little ritual for her, a little superstition. But that was the way people felt about melanoma. It had a very high death rate. That is no longer the case. The death rate from melanoma has dropped considerably. In fact, if melanoma is caught while it's still localized, just a local lesion, the 5-year relative survival rate is 99%. That's pretty darn good. Even if it's spread regionally, it's 68%. If it's spread, distantly to the brain, et cetera, then it drops down to 30%. And so the total of all of these stages combined is 93%. So once again, that's a pretty high survival rate. But clearly from those numbers, we see that the entire key to this is to find it early, right? Early recognition, early diagnosis of this. And melanomas are cancers that are taken out almost immediately. It's primarily a disease that shows up in older people. One study I looked at of 83,000 plus cases, only 2,000 of those were in people under 30 years old. Just a handful of children, 250 adolescents, couple thousand young adults. The rest were all 30 and older. Now, melanoma can run in families. There is a genetic risk factor that can be passed. So if you have a relative who had or has melanoma, be sure you get checked out even more often than other people. It's been very clearly shown that a good body check, having someone look you over, in fact, the highest prevention was in people that checked themselves at least once a year and had a spouse who checked them, and they did it in front of a mirror. So those are like the big high points. So you want to get checked regularly. Again, if you have someone you're close to, have them check you over. When I'm looking at new patients, one of the things that I will do almost always is look at the bottoms of their feet. That's actually a moderately common site for melanomas. Behind the knees is also relatively common. So I'll have people take their shoes off before I needle them and while I'm doing my exam. And so I will check the bottoms of their feet and their toes, et cetera. Melanoma accounts for a little less than 2% of global cancer cases. It's the 5th most common cancer in the United States. And while the number of cases has gone up a lot since 1975, about 300%, the mortality has fallen almost 30% over the last decade. So that shows you the difference in early diagnosis and the more current treatments, which are pretty good. It's from exposure to light, to sunlight, to not heat lamps, but tanning lamps, et cetera. And the UVB light is considered quite a bit more toxic than the UVA light, but there's a lot more of the UVA light. And UVA will actually penetrate glass and windows, where the UVB has very little penetrating power. So anyway, just get checked out pretty frequently. Now, next one is basal cell carcinoma, and that's the most common type of skin cancer. This almost always develops in people with fair skin, although people of color can also get this cancer. It looks like the melanoma has a lot of different ways it can look, but frequently it's just a little black spot. So if you suddenly have a mole pop up where you didn't have them before, or if the mole changes color or gets larger or starts oozing, et cetera, then go get checked immediately. The basal cells look like a kind of a flesh-colored round growth. Sometimes it looks like a little pearl, a little bump, or a little pinkish patch of skin. And this is usually from a lot of sun exposure. Often it affects the ears, the neck, areas that have been exposed to a lot of sun. And again, these are very, very rarely fatal, and pretty much never fatal if they're caught early. So again, check it out. You can now get skin mapping at some dermatology clinics where they do a scan of your body, a visual picture, and then they compare it. They do overlays, and they have computer systems that can now do the overlays to see if things have changed from one year to the next. If that's available to you at your dermatologist, I highly recommend it. It's inexpensive and very effective. Then the third type of carcinoma is squamous cell. Again, pretty much the same etiology as the basal. Light-skinned people are more likely, although people of color can develop squamous cell. Here is usually a red, firm bump, maybe a scaly patch, or a sore that heals and then reopens. And that's really common. They'll have a little sore, maybe they'll pick at it, it goes away, and then it comes back. And then they'll pick at it, goes away, and it comes back. So it's like this non-healing sore, and that's often a squamous cell. And again, this one is it's important to get early diagnosis and treatment for that. Now, the study that came out that I was mentioning, there's a 4-year risk of developing cutaneous squamous cell carcinoma. So that's squamous cell carcinoma of the skin. And they were looking at actinic keratosis. Now, some of you will know very well what that means. I myself go into the dermatologist, and they use liquid nitrogen, and they'll burn these little hard spots, little bumps off of my skin. Looks just like old dead skin, but that's called actinic keratosis. Some people will go in and they'll get their face covered with a cream like fluorouracil. And that, again, burns off the top layer of skin and takes the actinic keratosis with it. Well, what they found in this study, in patients who had been treated fairly aggressively for actinic keratosis, about 3.7% went on to develop squamous cell carcinomas. So that's a pretty big number, 3.7%. So if you go in and get keratosis burned off, or if you do fluorouracil or one of those other things, it's well worth getting checked out to make sure you don't develop squamous cell carcinoma in the same location. All right. So that's all I'm going to say. And I'm bringing that up because today is a big day, as Catherine said. It's the longest day of the year. Where we are right now, it's blazing hot. The sun is really hot. And it's one of those days that you could easily develop some of these skin cancers. So again, be very careful. Now, my rule of thumb is generally 10 minutes a day in the sun. And that's actually very important. We think of it for vitamin D production, but being in the sun does so much more than that. It changes your cholesterol levels. It affects your immune function. It affects your mood, certainly. So there are lots of other benefits. The point is, don't overdo it. 10-15, I'm very light skinned, so 10 to 15 minutes is really about all that's appropriate for me. Okay. Next thing I want to talk about is something that I'm seeing a great deal of, tremendous number of patients coming into my clinic that are either diagnosed with recent COVID, long COVID, or vaccine injuries. And the Results are the same, basically. I mentioned before, I have a mother-child, 12-year-old child. The child caught COVID, developed long COVID. Mom did not get COVID, but was vaccinated. They have identical symptoms. And the kids, we got cleaned up within about a month. Mom, we've been struggling a little bit longer. And so we're still working on that. And there are many, many factors involved in long COVID. If you're interested, check out Dr. Patterson at Stanford, who's developed it's probably 12 different markers for inflammation and cytokines. And he's created a long COVID index, and it's quite brilliant. And then he's created a treatment regime that is designed to get rid of the long COVID. Now, I only have one patient that's going down there, and she's been doing it for about 3 months, and it hasn't worked yet, but we're still hopeful. But the biggie that I treat successfully is micro-clots. Okay, tiny, tiny, tiny blood clots that are too small to be seen with normal diagnostic imaging. So it won't show up on an ultrasound, won't show up on an MRI generally because they're so tiny. But we're finding from pathologists all over the world and funeral home directors from all over the world that people are dying from and have, even if they die from something else, massive amount of clotting in their system. And so what I have done since the beginning, when I had patients fly in from New York after New York was hit so hard and they developed long COVID, is the first thing I look at. Now, of course, Chinese medicine, we're doing pulses, we're looking at their tongues, we're looking at other issues, and then I order a lot of labs. So we're really working to pin down exactly what the problem is in each case, right? And it can be quite different. But the common denominator is clotting, micro-clotting. And so I'll have people come in with lung problems. They can barely walk up the stairs. I treat them for clotting. A month later, they're fine. A week later, they're fine. And so we see this across the board that's almost always one of the things that needs to be done. Now, there's some very good studies that have come out of New Zealand. And I don't know why New Zealand specifically, but they seem to be doing a very, very good job of long-term COVID treatment. And so they've looked at many cases of long COVID, excuse me, and people who were hospitalized with COVID and then released. And what they found was the same thing I'm talking about, a lot of micro-clotting problems. And most of their patients were put on a triple blood thinning regimen, 3 different drugs to prevent, or 2 drugs and a supplement in some cases, to get rid of those micro-clots. One of my patients who's developed COVID over a year ago just started seeing me, and I gave him the studies, and he actually contacted the doctors in New Zealand and got even more information from them than they published, and then took it back to his doctor to get a blood thinning regimen started, and I'm sure he's going to be great. Unfortunately, that's not usually done in the U.S. Someone's in the hospital, they get to the point where they are deemed not to need hospitalization. They're sent out on the streets, but their blood is still clotting. So with Chinese medicine, we also have, or at least I use, a triple therapy for blood clotting. And so I find that to be very important. Now, there was a study that came out a couple weeks ago by Dr. Zwicker, and they showed that, now they were looking at hospitalized COVID patients. They said that patients who are hospitalized with COVID have been shown to have a high risk of thromboembolic events post-discharge. So what that means is blood clots. Thromboembolic are blood clots, thrombus that's lodged. And in this randomized study, they showed that in high-risk patients who were hospitalized for COVID, the use of thromboprophylaxis, so that's prevention of blood clots, and a particular other drug for 35 days after discharge, improved their composite outcomes of symptoms of deep vein problems, of superficial vein problems, and death. So that's a pretty good list of things that were improved by going on this particular regimen. So you could find Dr. Zwicker or Dr. Neil Majithia, Majithia, were involved in this study. And so that's pretty powerful stuff. Now, if they would just apply the same good sense to the patients that weren't hospitalized, okay, they need it also. Now, so with my patients, there's a series of tests that I recommend. As I mentioned, we feel pulses, we look at the tongues, we can tell a tremendous amount from that, and then the symptoms. But there's a series of tests that I will run. So if you have had COVID and you don't feel good, or you think you're going to be exposed, some of the tests to run are a D-dimer, D-I-M-E-R, and that's measuring clot breakdown products. So if you're forming clots, some of them will break down. This is used by U.S. doctors for deep vein thrombosis. It's part of the diagnostic tree for deep vein thrombosis, but they aren't using it for this. Now, in China, every patient that comes in to a hospital with COVID is one of the first things that's done is they're given a D-dimer test, first thing, and then they're quartiled. If they're in the bottom quartile, they're generally sent home with herbs and maybe drugs. If they're the second quartile, they're expected to need stronger treatment, maybe hospitalization. In the third level of D-dimer, they know they're going to need hospitalization. And the highest level of D-dimer, those people are much more likely to die. And so they use this test in every patient. And I think it should be used on every patient here also. It's not a very expensive test. It's a D-dimer. Another test that goes along with that very well is fibrinogen. And fibrinogen is the chemical, the factor that it will break down and form clots. So you get the fibrinogen, which is on the formation side, and the D-dimer, which is on the destruction side, and you get a pretty good picture there. The other thing I would recommend is a high sensitivity, sometimes called cardiac, HSCRP, which is C-reactive protein, which is a chemical given off if there is inflammation in the heart and or the arteries. So a high sensitivity CRP is very important. Another test that I recommend, and this is a couple dollars more, $80, I think, is the cheapest I've seen it. Although if you have 23andMe and or Ancestry or one of those genetic tests, you can run it through a company called Stratagene, and they will check you out for these folate. They're actually folate SNPs, single nucleotide polymorphisms that are defective. One of those is C677T. That's the more common one. A1298C. A1298C is another one. About 30 to 40% of the population is positive for C677T, and about 15% of the population is positive for the 1298. And so if you happen to have both, and I've seen a lot of patients that have both, because when I look at their symptoms, it tells me they probably have both. It's a lot more common than one might think. And if they have all of those factors, they may be producing 10 to 20% of the active folate that they need. And folate is needed for many dozens of functions in the body. It's a very, very important vitamin, actually. And so with the MTR, that's what we're talking about here, methyl tetrahydrofolate reductase, and that's what we're looking at with these two genes. These are extremely important. You're now seeing most fertility centers running these routinely on their patients because they're involved in a lot of processes. So, they started giving pregnant moms, folate many years ago to prevent spina bifida, where the spine doesn't develop properly. Well, if someone has these MTHFR problems, SNPs, then even if they're given folate, it won't help. In fact, it can make it worse. There's not enough high quality folate to prevent the spina bifida. And there's some studies showing that in women given folic acid, right, straight folic acid, which is an artificial form of folate, and that have these genetic SNPs, they have much higher autism rates, or their children have much higher autism rates. And the thought is this builds up in the system. It doesn't do what it's supposed to, but it causes other problems. So anyway, anybody that's pregnant or thinking of getting pregnant should get those checked. And I will get patients that come in, and after taking their history, I will simply assume that they have this problem because there's a series of signs and symptoms that show up here with low folate. Depression is classic. When you see a family that's had depression, particularly if there were some heart attacks and blood clotting disorders in there, first thing I'm going to do is suspect depression. Psychiatrists now have a drug, which, by the way, is just high quality methyl tetrahydrofolate. If given with SSRIs, reduces depression by about 30 to 35%. Now, I suspect the SSRIs aren't even helping in that case because the high quality MTHFR MTHF will reduce depression by about that much. The other place where it really plays a role is, although we don't hear much about it anymore, things come into the news and then they get out of the news cycle and they disappear. But there are still a significant number of women who have strokes and or blood clotting disorders when they go on birth control pills. And most of those women, or at least many of them, have this folate problem, and the pill exacerbates it. But it's been shown since the 50s that in people with folate deficiencies, and typically with other B vitamin deficiencies also, there's the higher rate of schizophrenia and bipolar disorder. Hoffer in the 50s was reducing the incidence of schizoaffective effects by about 50% just by giving B vitamins. So of course, that didn't go over very well because there's no money in giving people B vitamins. So basically that whole line of inquiry went down the tubes, but it's still very effective. Chronic pain and fatigue, migraines. Again,
the question.
Okay, question.
What are the polymorphisms again?
What does that mean, or what are they?
What are they?
There are many, actually. With folate, there are 5 common ones, but the 2 most common are C677T and A1298C. Those are the 2 most common.
Thank you.
You should be back. So anyway, anxiety, depression, bipolar, schizophrenia, etc. And the New Zealand study that I mentioned, the major study, the last paragraph of the paper, it was fascinating. They went through all of these great findings and how they were treating COVID and long COVID. And the last paragraph said, and we found that patients with the C677T polymorphism were dramatically more likely to have long COVID. So I thought that was pretty interesting. So again, they're more prone to blood clotting, just as in general. And so when you add on top of that the blood clotting from COVID, then you get this double whammy. Okay. So I would get that tested. And then while you're at it, get a CBC, complete blood count. And one of the key factors I look for there are platelets. Doctors don't pay a lot of attention to platelets unless they're low, but in the normal range of platelets, which is up usually in most labs up to 450. At 400, there is 4 times the mortality. 400, right? It's huge, huge, huge. 4 times, 400% times the mortality, and still being in the correct range. So definitely want to run that CBC, which is like $5 for the whole thing. It's really cheap. And I would do a Chem 14, which is less than $15. And there are a lot of things I'd look for there, but a lot of it's in the gallbladder and liver issues. I want to see liver enzymes and heart enzymes, et cetera, because that's a secondary thing, but it can be important. Now, what do you do about it? Okay. You can go to your doctor. You can request a triple blood thinner treatment. Good luck. I have not had great success with my patients. So we use Chinese formulas plus other supplements. So number 1 are Chinese herbs. A fellow named Yan, Y-A-N, Dashin, D-E-Xin, wrote a brilliant book called Aging and Blood Stasis. And in there, he posited and proved that the primary cause of aging and death is blood stasis, the blood being too thick, too high a viscosity, and not getting where it needs to go. So in diabetes, the blood gets very sticky. It can't fit through the small blood vessels in the kidneys, in the peripheral vascular system, and in the eyes. So you get blindness, kidney disease, or kidney failure, and neuropathy. So anyway, it's a brilliant book. So using some of his formulas, but then using other formulas from the Chinese pharmacopoeia. And this is one of the things that I guess if I want to get frustrated about anything, it's this. I'll talk to doctors, I kind of expected, but even the lay public, right? You've got to know, that Chinese medical herbology is dramatically, it ain't even close, it's dramatically better studied, better researched than Western drug treatments. The same people doing the research on the drugs are doing the research on the herbs, and they're doing a lot more of it, and they're doing it a lot more extensively. So I have here a paper on a formula that we use a lot of. It's called Shentong Juyu Detoxin Inhibits Inflammatory Response. And then there are several more lines after that. And it's about 20 pages. And it goes through the specific, it inhibits the expression of BCL-2, CDK4, cyclin D1, MAPK, and P-P38, and CTGF. This is not folk medicine. They've taken this apart. They've studied the cytokine levels. Now, this is on a formula that's hundreds of years old, and they knew it worked. But now they're doing, or not now, but over the last 50 years, have been doing this incredibly in-depth research to see precisely why these things work. They're much safer. They're not as strong frequently. Like if someone comes in with a blood clot into a hospital, you want to hook them up with heparin. Heparin works almost instantly to break down blood clots. But if you're going to send something home, this is a great formula to send home. And again, it goes through the entire inflammatory process. It has 53 research sightings here. And this is not unusual. These are available on every Chinese formula because the Chinese are really clear. This is a big cash cow for them. They don't want to have to buy Western medications if they have something else that works as well or better. Plus, they can sell these herbs to us. The price keeps going up, and it's going to go up a lot more pretty quickly with all the supply chain issues. So this is a huge thing. And you got to understand that we've been brainwashed. Okay. The brainwashing started with Bernays, Edouard Bernays, who was Sigmund Freud's nephew. At some point, I'll do a whole show on him. He was an incredible piece of work, but he called himself the father of spin. He wrote a book called Propaganda, where he laid down the entire propaganda machine. He set up the Rockefeller control of medicine. So when the trusts were busted in the early 1900s by Teddy Roosevelt, they broke up the steel trusts and the railroad trusts and all these big trusts. Well, these wealthy people were angry and they really wanted to get back at the government. And Bernays said, you don't have to do that. Let's put all of your money into an industry that the government will never break up, and we'll give complete control of this and market it and advertise it so everybody thinks it's the only form of medicine that works. And that's called the Rockefeller model. And Bernays set it up. He's the guy who did the, torches for victory, I think. And so he got women to smoke on the Macy's Day parade floats, which women up until then did not smoke in public. It was not considered appropriate. And he said, hey, this is freedom for you. You start smoking out there. And so we got them all smoking. He's the one who got the Surgeon General to support smoking and to even advertise which types of cigarettes he thought were best. So this guy was brilliant. But it was through the work done that most of this country thinks that drugs are the way to treat illness. They aren't. In almost all cases, I mean, sometimes they're magic. You have a raging bacterial infection, antibiotics can change your life. You have a horrible autoimmune condition hit you, man, there's nothing like steroids. God bless them. They are so amazing. But most medications people are put on and never taken off. That tells you it's a Band-Aid. It doesn't fix, it doesn't heal. You're on blood pressure medication. Well, it doesn't fix your high blood pressure. It suppresses your blood pressure. Where herbs are more likely to actually fix the problem and with a much higher safety index. And so when you think about these things like supplements and food, well, they're not controlled by the FDA. Thank God, right? Because the drugs are, and the FDA is bought and sold. The FDA is sponsored and funded by the pharmaceutical companies. So you want to talk about a case of the fox watching the hen house, there is no better case than the FDA. That's what they do, right? So when you start thinking about remedies, really think long and hard about supplements, which are basically food in concentrated forms, and herbs, which essentially are food in concentrated forms. Now, the sophistication of this, for example, I mentioned that formula, Shentong Juyusan, which is a systemic formula for blood stasis. We use it for spinal stenosis. It lowers the inflammation. We'll use it for pain anywhere in the body. That comes from a formula called Shui Fu Juyusan, which means to clear stasis in the mansion of blood, which means the chest. So it has herbs that get rid of stasis, but specifically in the chest, the heart, and the lungs. And then you change a couple of herbs in the formula. They're called guiding herbs that make the activity stronger in one part of the body or another. And you get Ga Sha Juyusan, which means the same basic formula to treat below the diaphragm. So the liver, the kidneys, this middle part of the body. And then brilliantly, you change a couple more herbs and you treat what's called the lower jiao. So this is the urinary area, the pelvic floor, the uterus, the ovaries, etc. And same basic idea in all of them, but you just change one or two of the guiding herbs. Now, at this point, each of those formula has been dissected ad nauseum to find out specifically what the biochemistry is that does this. And, you know, when you do the biochemistry, it makes perfect sense. So do Chinese herbs, find someone in your area that can do that for you. And then I recommend taking nattokinase, which I've talked about before, so I won't talk a lot, but it's an amazing blood mover. Serrapeptase, which breaks down those nasty fibrin deposits and just explodes blood clots. Fish oil, which, you know, if you go in for surgery, your doctor will tell you, stay off fish oil because it thins the blood. Likewise, vitamin E, they'll say stay off of. Ginkgo, good old ginkgo, very effective for blood stasis. Grape seed extract, not grapefruit seed. That has other really powerful uses, but grape seed extract, I often combine with nattokinase and serrapeptase for people that are flying. And that combination has been shown to reduce blood clots after flying by about 80%. And there are dozens of other choices beyond that. Pterostilbene, which is from berries. But if you had just wanted to keep it at a minimum, nattokinase, serrapeptase, and fish oil would be where I would go first. All right. Let's see if I have any more on this. No, that's good for that. A couple other little quickies I wanted to talk today. I wanted to reinforce a couple of food ideas that most of you are already on board with, but there are some new specific articles that have come out based on research studies. And here's one from the Journal of the American College of Cardiology. Okay, sounds important. And it's titled Obesity, Metabolic Syndrome, and Prediabetes. That's the larger title. And then it's olive oil intake and total and cause-specific mortality. Now, we've all been told that olive oil is good for us. It's monounsaturated. It has all these great qualities. But here they've looked at the statistics from these studies. And this is a 2020 study that was published, as I mentioned, in Journal of the American College of Cardiology. And it was a big study. They looked at 61,181 women, 31,797 men. So that's about 93,000 people. That's a good, healthy study. And people who consumed 7 grams or more, 7 grams is half a tablespoon of oil versus people who didn't consume any after 24 years of follow-up. So again, these are the studies you want to look for. 100,000 people, 24 years of follow-up. The olive oil group had 14% lower risk of cardiovascular disease and an 18% lower risk of coronary specific heart disease. And if people had hypertension going in, it was even more impressive than that because it was helping to thin the blood, which is good for the hypertension. And so the hazard ratio was 0.81. So again, that's about a 19% reduction. And if the olive oil replaced bad fats, plant-based oils, for example, dairy fat, there was an added 13 to 19% of mortality reduction. So you take out all the vegetable oils, the bad dairy fats, there's some good ones, but take out the bad dairy fats, and you're getting about a 40%, 35 to 40% risk reduction. So it reduces inflammation, it lowers blood pressure, it improves the endothelial function. So that's the lining of the blood vessels that are so critical. It improves insulin sensitivity. So it's going to control for diabetes, and it raises good cholesterol. Now, the key, of course, as with everything so-called natural, is quality. You want to get really, really good extra virgin olive oil. And there are several organizations that will publish on an annual basis reviews on olive oils. And sometimes it's surprising. It's not necessarily the most expensive that come out on top. Sometimes it's less expensive brands that check out really, really well. Now, olive oil, I mean, I have a brother who every time he comes over will open my cabinet, pull out the olive oil and take a big chug. A lot of people will take olive oil straight. If you do it on an empty stomach in the morning, it has particularly good qualities for weight loss, for blood sugar controls, lots and lots of good things. It's healthy and good quality monosaturated fats, loaded with antioxidants, strong anti-inflammatory action. It's been shown to reduce stroke risk pretty considerably. You won't gain weight or obesity, even though it's a fat. It does reduce type 2 diabetes risk. It's helpful for rheumatoid arthritis and joint pain. So again, just get the best quality you can get and have fun. Okay. Next thing I'm going to talk about is our old friend, the avocado, which, like so many foods, have gone through this, what do you call the pendulum? It's the best food on the market. Oh my God, it's evil. Don't eat it. Back and forth. Well, now it's swung back to, oh my God, this is a great food, right? We're back to that. And here's a study that was done recently or reported recently. And again, from the Nurses' Health Study and the Health Professionals Follow-Up Study, very large study, 24 years worth again. And the individuals who ate avocado frequently had a 16% lower risk of cardiovascular disease and a whopping 21% lower risk of coronary heart disease. So again, we're seeing protective effects against cardiovascular disease, against stroke. It's good for weight loss. It's just pretty amazing the great things it does. In fact, after I'm lazy when it comes to food. I admit it. And so the problem that I have with avocados is I'll buy them, and then I always miss the ideal date, when they're really ready. Either they're too hard or they've spoiled. So I've actually I went to Costco and bought 12 little cups of guacamole, right? Now, fresh is better, but I at least do a cup of that guacamole every day, which I love. It's just fabulous. And again, I'm not saying go to Costco. I'm just saying that's where I went because it was inexpensive. And boy, I love it. I got a good, healthy cracker. So I'm now getting away from my potato chips and onto really healthy crackers and avocado. So anyway, I want to take advantage of that 21% reduced risk. And this was actually even a little more robust than the last study. Here it was 110,000 people that they watched. And yeah, so very, very, very effective. And it seems as though the more you eat, the better it is. There didn't seem to be an upper limit. And here it was greater than 2 servings a week. So that's not much. Greater than 2 servings a week at a 16% lower risk of cardiovascular disease. So, but there's nothing, you go out and look at cholesterol studies. Statins don't even come anywhere near that, not even close. And of course, statins many of them have very negative side effects. I'm not speaking for or against statins. I'm speaking for avocado. It's like if you can lower your risk by much more than you would lower with the statins, and you have something that's good to eat and good for you, I'd say jump on it. This is the opportunity. Speaking of cholesterol, I do want to mention one thing. I got a couple more minutes here. Another study looked at 68,000 adults over 60 years of age, and that's an important number here. Over 60 years of age, and it was published in the British Medical Journal. And they found that people over 60 lived longer, were healthier, had a better chance of dealing with disease if their cholesterol was higher, even their so-called bad cholesterol. If LDL, which they consider bad, was elevated, you had a better chance of leaving the hospital alive if you went in with some illness or needed surgery. Okay, so don't freak out about cholesterol. Now, when I see a 30-year-old guy come in and he's got so-called high cholesterol, I'm concerned about that. More because the cholesterol is a sign, it's a symptom that there's something bad happening in the body, more so than the cholesterol itself. I mean, and the cholesterol can be a problem once it oxidized or is oxidized. That's the problem. And there are many natural supplements that you can take to help keep the cholesterol from oxidizing. Okay. We carry several things. I have a formula called Colisma. I had a patient come in, one of my favorites. Her husband's an MD. And so I'd helped her get off her anxiety medications, helped her get off her depression medications over the years, just doing great, just bright woman, doing fabulously. And one day she comes in, I hadn't seen her in months, and she just was practically hysterical, running into my office. You got to help me. You got to help me. Okay, what's going on? My cholesterol is 350 and my doctor and my husband are both totally freaked out. I said, okay, well, let's look at that. So we put her on a couple of things. Colisma was one of them. And we got her total cholesterol from 350 to 220 in 6 weeks. Now, in a woman her age, menopausal, I don't really want it less than 220. I said, but we'll keep it here, and that keeps your husband and your doctor happy. And she's been fine ever since. So that was the herbal formula Colisma. For cholesterol itself, aged black garlic, you can do it yourself or you can buy it, will help keep the soft plaque from forming in the arteries, right? The new stuff that goes in there and it's soft and it builds up. Vitamin K2 actually works on GLA matrix protein to pull the calcium out of your soft tissues, and then through a couple processes stimulates osteocalcin to put calcium into your bones and your teeth. I mean, what more perfect vitamin supplement is there for someone that's over 40? You take the calcium out of your arteries, you take the calcium out of your heart, and you put them into your bones and teeth. Now, very important to remember that women who are menopausal take vitamin D and calcium supplements have over a 30% increased cardiovascular risk, because the vitamin D stimulates the calcium, moves the calcium, activates the calcium, but it doesn't direct it. Vitamin K2 is the director. It says you don't go in the arteries, you go in the teeth. Yeah, you don't go into the soft tissues, you go into the bones. So it's the vitamin K that guides everything. So if you think or know that you have a plaque problem or a cholesterol problem, vitamin K2 and the aged black garlic is probably the way for you to go. We carry a supplement called Lipotrol, which is very, very effective at dealing with cholesterol. Well, I see that I'm just about out of time. And so again, I wanted to hit, pardon me?
Oh, we have a question.
Okay.
The question is, anything about avocado oil?
Yeah. Avocado oil is, can you turn down? Okay. Avocado oil is one of those oils that's tricky, right? One of the reasons that, well, avocado oil is great because it has a high smoke point. It has a good oil blend, but many people think it oxidizes faster or easier than olive oil. And you get some disagreement there. It's a fabulous oil, but I would get it either in a very dark glass container, or often it'll come in a metal container, and keep it in your refrigerator. And if you do that, it should be great. Maybe better than olive oil even, but I don't know, because there have been dozens and dozens of studies, hundreds on olive oil, and only a handful on avocado oil. So I'd say either one should be fine. But again, be very, very careful with any plant-based oil. You want to keep them dark and refrigerated. Yeah. Okay. Well, hey, it's 3:55 on my clock. I don't have time to get another topic in before 4. So I'm going to shelve a couple of these till later. I've got a few that I think you're going to love. I'm going to do one on dementia prevention. I hope you all love that. And it's really, there's a lot more information on prevention and even reversal than most people are aware of. I'm going to look at some specific tests in detail that you might want to think about. And I'm going to take another run at water and fluoridation. There were just 2 studies published since I spoke last, which is only a few weeks ago, about dramatic new problems they're finding with tap water. And so there's a whole new group of things we need to be careful of. All right, so I'm going to talk about those things over the next few weeks. Please send us your questions. I love your questions. So until next time, be happy, be healthy, and I'll see you soon. Bye-bye.